Stem cell therapy is an experimental therapy that does not fall into the realm of accepted modalities of treatment. The results reaped from this therapy may differ from person to person. Stem cell therapy aims to bring about a significant improvement in the quality of life.
My name is Matthew Sims. I'm from Colorado, and I was born with septo-optic dysplasia, which is my optic nerves aren't fully developed.
My name is Rajiv Saluja. I am from India. I am suffering from multiple sclerosis, and I have had this recollect since, diagnosed since '95.
I'm Shelly Dykes. I'm from Wisconsin, and this is Cassidy, and she's 8.5, and she has cerebral palsy, optic nerve hypoplasia, and epilepsy, and that's due to problems at delivery, lack of oxygen.
My name is Cristian Nasaudean. I come from Romania. I'm here for healing for multiple sclerosis.
I have tried all sorts of treatments, naturopathy, homeopathy, a whole lot of things, but nothing works.
I could still see, just not clearly enough and be able to get to drive, and the doctors were telling me that my disability was not correctable and there was no surgery or anything would fix it.
I don't want to be 80 years old, and not to be very blatant here, but to be on my deathbed and know that I didn't try everything for my daughter to give her a better life experience.
Stem cells are undifferentiated cells which have the ability to spawn other specialized cells that perform the very tasks that keep our body functioning properly. Every day, our human body needs to make millions of new blood, skin, and brain cells. When a stem cell divides, each new cell has the potential either to remain a stem cell or become another type of cell with a more specialized function, such as a kidney cell, a heart cell, or a nerve cell. Given their unique regenerative abilities, stem cells offer new potentials for treating diseases that impair and degenerate tissues and organs in the human body and brain. In 2001, the George Bush administration banned stem cell research in the United States, and a lot of the top doctors and scientists involved in regenerative medicine came to China to continue their research, founding many organizations. This ban has been reversed by President Obama in 2009. Beike Biotechnology Limited is one of those organizations and was founded in 2005 as a collaboration of the best and brightest stem cell scientists and groups in China. Today, it is one of the leaders in regenerative medicine and offers stem cell treatments for a number of diseases that are considered incurable using conventional medicine.
Beike is a joint venture company which is established in year 2005 with Peking University and Hong Kong University of Science and Technology as our shareholders. Since then, over 6,000 of patients from 59 countries who is having so-called incurable diseases has been treated and helped by the stem cell treatment.
Currently, 30 big partner hospitals in China are using Beike's protocol for administering stem cell treatments, and Beike has established 18 state-of-the-art GMP or Good Manufacturing Practice laboratories in different cities across China. Beike has over 400 staff and is expanding its operations into other countries like India, Thailand, and Panama. It is also strengthening its position as one of the global leaders in stem cell research and development, and has just become a major shareholder of a Japanese biotechnology company called Biomaster, which has the technology to isolate stem cells from fat. Most patients only experience improvements once they return home after the month-long treatment. One such patient is Rajiv Saluja from India. Rajiv suffers from multiple sclerosis that, among other things, affects his bladder control and hampered his mobility. He began his stem cell treatment back in March 2007. Over the course of 4 weeks, he received 5 injections of stem cells.
During my stay in China, there was not much effect of that treatment. However, on completion, after I came back home, I found changes happening pretty fast. I found that a problem which I had, bladder control, was 100% okay. That is something big. If that itself alone stays okay, I think tremendous. I had a problem of being able to write. I couldn't control my hand muscles for writing. Maybe if you think about it, it was like a 2 or 3 year old person's writing. Now I write, I'm not saying I'm an artist, but I write pretty decently.
Like Rajiv, patients from all over the world come to get stem cell treatments in Chinese hospitals.
Up to today, Beike has treated people from various number of international countries like America, the UK, Australia, Canada, even some European countries like Romania, Hungary, and now we're starting to see patients coming from the Middle East as well. Well, basically for international patients we had to establish a completely new infrastructure designed for foreigners coming into China. So we selected some of the best hospitals available in China, and those locations are currently in Qingdao, in Nanjing, in Guangzhou, and also we have a facility in Hangzhou as well. And within those facilities we choose the best floors that the hospital has to offer, and we also equip it with lots of Western facilities, television, internet access. We make sure that there are English-speaking patient coordinators that can receive the guests at the airport and make sure that during their time in the hospital they're well looked after. We also select English-speaking doctors and English-speaking nursing staff as well.
Hello.
We've also found that some patients have found the treatment so beneficial that they're actually returning again to China for a second or third, and in some cases even a 4th treatment as well.
One such patient is Ella, who suffered injury at birth and after a round of treatment in China, returned again for a second one at a hospital in Hangzhou in November 2008.
Ella's specialists have also noticed a lot of improvements. They were sceptical before she went away, and over the 3 to 6 months they've noticed some remarkable improvements, and they have written that in reports. Her hand movements have improved as well. Beforehand she had improved her right arm movement from the previous treatment, but after this set of treatments she has more dexterity in her right hand, and she started to hold objects, which she hadn't done beforehand. Also, before she used to, if we gave her an object to hold in her right hand, she would automatically move it to her left hand. But now she passes objects to and from both hands, which is a remarkable improvement.
This is Cristian from Romania, and he suffers from multiple sclerosis. Although it is too early to tell, Cristian has shown some little improvements in his condition.
I come here walking with a stick, and here I gave up the stick. I'm walking still near the walls, but not using the stick inside the building and so on.
It is finally time for Cristian to get his last injection of stem cells. In Cristian's case, stem cells will be injected directly into his spine through a lumbar puncture, also known as a spinal tap. Lumbar puncture helps to deliver stem cells directly into the cerebral spinal fluid of the brain and spinal cord, bypassing the blood-brain barrier. After injecting the cord blood stem cells into the spinal cord, they travel to the areas of the spine where myelin damage has occurred. Over the course of treatments and with time, the cells regenerate the lost myelin, resulting in better communication between the central nervous system and the brain. For his treatments, Beike uses screened umbilical cord blood-derived adult stem cells. As has been shown in numerous studies, Hematopoietic stem cells have the potential to regenerate blood vessels, can transdifferentiate to form tissues, and secrete vital chemical substances called chemoattractants and other cell growth factors which promote regeneration. For some disorders, like multiple sclerosis, it recommends umbilical cord-derived mesenchymal stem cells, as studies have shown that mesenchymal stem cells can assist in development of cartilage, liver, and brain tissues. In some cases, doctors also offer the option of using the patient's autologous bone marrow-derived stem cells. Baker is also conducting research and development to explore other sources of stem cells like adipose tissue, dental pulp, menstrual blood, etc. At Baker, utmost care is taken to ensure that patients receive the freshest and highest quality stem cell products. Screened stem cells are separated, cultured, and harvested in state-of-the-art high-tech GMP laboratories and delivered to treatment centers. In the room adjacent to Christian's, Matthew, along with other international and Chinese patients, is being administered stem cells intravenously via intravenous injection or IV. Lumbar puncture and IV aside, stem cells can also be injected using the good old-fashioned local injection, which comes especially in handy when implanting stem cells directly into and around an injury site. Treatment at Baker not only consists of stem cell injections, but also exhaustive rehabilitation therapy that patients have to undergo on a daily basis. Most patients have 2 sessions a day for a total of 2 to 3 hours. Depending on the patient's condition, a schedule of rehabilitation therapy is planned and consists of a tailored mix of physical therapy, occupational therapy, speech therapy, acupuncture, activities of daily life education or ADL education, and massage. Scientists and rehabilitation therapists at Baker strongly believe that physical stimulation aids the stem cells in their work and encourage patients to continue their exercises for at least 3 months following the treatment. So what does the future hold for patients? And what do they expect to get out of this whole experience?
Just to get maybe 50 to 70% better than what I am right now. Get out and drive my car, walk, go to the mall, go shopping, something. But just sitting at home, my quality of life, I want my quality of life somewhat back.
To have better vision, which I'm already experiencing, and possibly be able to get a limited driver's license down the road.
I am not expecting a cure, because I know there is no cure. But who's to say? In 3 to 5 years, there might be.
I have become more positive about going out. I interact more with people. I'm not confined to any one area.
It's hope where we didn't have hope before.